Downsizing jewelry during the healing process. We're going to go through the pros, the cons, the advantages, disadvantages. Coming up next on Pros and Cons by Piercer, Season 2, episode number 58. So stick around. For those that are new to the Body Piercing and Tattooing channel, first off, welcome to the channel. Hope you're enjoying the videos. Hope you're finding them helpful. But you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. What we're going to talk about today is the fact that we often tell people to downsize jewelry during the healing process. We're going to go through the advantages, the disadvantages of that. This would cover things like helix piercings, trachea piercings, nose piercings, nostrils, lip piercings, oral piercings, nipple piercings, and various other ones. Anywhere that it is done with a post-style piece of jewelry, we always have to put something in too long for the actual piercing. And the reason for that is to allow for that extra room for inflammation, aka swelling, during the healing process. Once that swelling is complete, that period is completely gone, leaving that longer piece in there can cause issues. And we're going to go into that. So let's start with the pros, the positive, the things that we like about this. Number one, decreases contact. Basically, depending on where it's at in your body, especially the mouth, reducing contact with other things is going to make the healing much easier and less traumatic, and also reduce maybe risks that are involved, like with oral piercings, of enamel erosion and gum erosion. Number two, less chance of catching the jewelry. This is really prone with anything that's on the face or the head. Having that longer piece in there is just going to be more likely to get it snagged on something. Number three, reduces migration. Migration, for those that don't know, is where a piercing, even though it was pierced in this position, will slowly move into a different angle or a different place. The body kind of pushes it there, leaving that longer jewelry in, which makes the piercing sit maybe a little different than it would naturally with a proper fitting jewelry, will cause it to move, sometimes tilt, sometimes move out of placement. With oral piercings, especially tongue piercings, even though they might have been pierced in the perfect spot, when you close your mouth, you add that pressure because the barbell's too long and causes it to twist and turn. With ear piercings, it's really common for them to move out of alignment. So downsizing will reduce the likelihood of those things happening. Number four, less jewelry movement. With that longer piece in there, it can slide back and forth a great deal more if it's a tight-fitting or a close-fitting piece, because there's more room for it to move. So putting a shorter one in there is going to reduce the likelihood of agitation bumps and other problems that are caused by movement. And number five, it just fits better and it looks better. The other thing would be is that with oral piercings, it may reduce the risk of contact with teeth, gums, and the bone structure in your mouth. So it just makes everything better once you go to the shorter length. Now let's move on to the cons, the disadvantages, the things we aren't particularly fond of. Starting with number one, agitating the piercing. Now, if it isn't done correctly and the jewelry is changed and during that process it somehow agitates the piercing, that can lead to problems, including the agitation bumps, possibly losing the piercing, or starting the healing process all over again. That's why it's important to go see a piercer and have them do it, and it's important that your piercer has the proper tools to do it correctly. Number two, can't get the jewelry back in. Worst case scenario is they take the jewelry out and then they can't get it back in, or you do the same. That could be a situation where you may have to have the piercing completely re-pierced all over again and start the healing process all over again. Number three, the added cost. Though in most cases, including my own studio here at the Axiom, we give you a reduced price when you come in to get your jewelry downsized. It is going to cost you more money in most cases. There are a few studios out there that may give you a downsized piece for free. They might just kind of consider that part of their overall cost. But for most places, they're going to charge you for the piece of jewelry. The other thing they may charge you, which I'm not very fond of, is actually doing the downsizing. I don't understand why people have to charge $20, $30, $40 for something that takes 5 minutes and requires using maybe 2-3 tools and a pair of gloves. But that's me. Number 4, one of the worst case scenarios is that it causes trauma, which leads to swelling, and then you have to come back in and have the longer piece put back in, basically to allow enough space for that swelling again. This doesn't happen very often if it's done properly, but it is a possibility. Number 5, if you're planning on doing this at home, investing in the proper tools to do it can be a little bit expensive. You're looking at probably about $15 to $20, depending on the quality of guide pen you get, hemostat, etc. So there is an added cost whenever you downsize, even if you do it at home. Now I'm going to cover just a few questions we commonly get asked with downsizing. When should you downsize? Usually with tongue piercings, anywhere from 7 to 10 days is generally what I suggest. Other oral piercings, I suggest waiting a little bit longer in every other piercing. Usually a good rule of thumb is between 4 and 6 weeks. Usually the swelling is completely done at that point, and the transfer is going to do the least amount of trauma to the piercing, and your body is not going to react as much because there's usually a little bit more of that formation of the actual piercing. What tools would I need to do this at home? The first thing you need is a guide pen. Depending on if it's threaded jewelry or it's threadless jewelry, either way, I would suggest a guide pen. A guide pen is a taper pen with a lead off the large side that fits comfortably inside the jewelry, either threaded or threadless, which makes the process much easier to change the jewelry and downsize. Because basically what you do is take the old jewelry, take the end off, put that guide pin in there, push it out so the guide pin stays in there, disconnect the old jewelry, put the new jewelry on, push it back through. This method is going to cause the least amount of impact on the piercing, trauma, etc., and eliminate the possibility of the piercing, of not being able to get the jewelry back in because the piercing is never closed. The second possible thing would be hemostat, something to grip onto that jewelry while you're unscrewing it without putting a lot of pressure on the piercing or causing issues or trauma to the piercing. Usually having something to kind of grip that post makes it a lot easier, especially in tight spots like your nose and etc. There's other methods you can use, like, for example, using dental floss and making a slip knot and wrapping that around the post end, but that's not really going to hold it, especially with threaded jewelry. You kind of need to be able to grip that one. And moving it back and forth and trying to stick your finger in your mouth and all this other stuff can usually cause a little additional trauma that may lead to swelling and may be a situation where you have to put the longer one back in. So usually a set of hemostats or something to grip the jewelry is a good idea. The old school, DIY method is to take a pair of regular pliers and then take cloth medical tape and wrap it around the outside or on the gripping part of the pliers to reduce the likelihood of scratching anything. This method is a last resort kind of situation, not the best option, but it is an option. And the last thing is having a baggie or something to hold the jewelry in once you remove it. You do not want to put jewelry loose in a box. It's just going to end up getting damaged when it comes in contact with other metal. Goes without saying, I would hope. But individual little baggies to store your old jewelry in is always a good idea. Do I need to downsize? Is another common question we get. If the jewelry is much longer than the piercing thickness, yes, you do. That longer post, wailing around in there and etc. is going to cause problems. If it's an oral piercing, like a tongue piercing, and you like the longer jewelry because you get to chew on it more, think about what you're doing when you're playing with it and the possibility that that's just going to cause a lot of damage in the long run. The shorter, tighter fitting jewelry is going to be a lot more comfortable and less prone to have that impulse to chew on it, tug on it, and etc. Type of piercings are the piercings done with post-style jewelry, either a curved barbell, straight barbell, labret stud, etc., which is a majority of the piercings we do in this day and age. There are still a few that we do with circular barbells and rings, but that's like the exception. Those really usually don't need to be downsized because the jewelry is going to be the same that we put in there for the end result. Then there's the piercings where swelling just isn't as big of a factor. Prime example of this would be navel piercings. Usually we pierce kind of just to fit. It doesn't really swell enough that we need to have a lot of extra room, and even when it does, it's usually minute. It doesn't cause as much impact as, say, a tongue piercing would, or an eyebrow, or a lip, or upper ear cartilage, etc. So with those, you usually don't have to downsize. If it looks like it fits correctly, it's probably going to be okay to not downsize. If in doubt, always call your piercer and ask them. Well, that's it. I hope you learned something. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see your body piercing needs in the future. Have a good day, everybody. Take care, and thank you for watching. And check out one of these other videos.